Hello, folks. I'm really excited to share with you this RCOG paper on coronavirus vaccination in pregnancy. Now, this can be accessed on the Royal College of Obstetricians and Gynecologists website, and it's titled as Coronavirus Vaccination in Pregnancy. Now, it talks about the four different vaccines that you have at the minute. So, the Pfizer vaccine, which has got an efficacy of 95%, the Oxford AstraZeneca vaccination, which has an efficacy of 66.7%, the Moderna, which is efficacy of 94.1%, and the Janssen vaccine has an efficacy of 66.1%. So the Pfizer and the Moderna are mRNA vaccinations, the Oxford AstraZeneca and the Janssen are viral vector vaccinations. So it talks about some of the side effects that have been reported. So minor local reaction like pain, redness, swelling at the injection site, systemic mild reactions like fatigue, headache, myalgia, which is just muscle pain, and tend to be short-lived. 10 to 20% of participants had a fever after the vaccination, and these adverse effects are more common after the first dose than the second dose for the Oxford AstraZeneca vaccination, and more common after the second dose and the first one for the Pfizer and the Moderna vaccination. So, eligibility for vaccination in pregnancy. So, vaccinations should be offered to pregnant women at the same time as the rest of the population based on age and clinical risk. Pregnant women should be offered the Pfizer or the Moderna vaccination unless they've already had one dose of the Oxford vaccination, in which case they should complete the Oxford vaccination course. So, this is the current advice from the healthcare professionals, and as I said, this is from the Royal College of Obstetrician and Gynecologists, who maintain standards and publish guidelines for pregnant ladies, for their care during the pregnancy, after the pregnancy, and so forth. All right. So potential fetal and maternal effects. Now, this is what worries everyone, and this is some of the reasons why people aren't so keen. So minor and short-lived adverse effects include soreness at the injection site, headaches, fatigue, just common in the general population after a COVID-19 vaccination. For maternal effects, vaccine-induced thrombosis and thrombocytopenia. This has been shortened in this article as VITTT. Now, this has been reported after, this is rare, it's important to know that this is rare, and it has been reported after the Oxford AstraZeneca vaccination, and has also been reported after the Janssen vaccination. Now, VITT is unpredictable. It's something that and it's not associated with any of the usual venous thromboembolism risk factors. So there are things that increase your risk of having a clot. It could be things like your age, your BMI, whether you smoke, whether you've had any previous history of developing a clot, a family history. So many risk factors of developing blood clots in pregnancy, and generally as well. So what I'll do is I will link the venous thromboembolism guideline below, so you could also refer to that one. But basically, what they're saying is, if you, it's irrespective of these risk factors. This is rare. The vaccine is induced thrombosis, and it's not linked to your venous thromboembolism risks. Now, it has been described as presenting at 5 to 28 days after the first dose, particularly in adults younger than 50 years of age. Pregnancy increases the risk of coagulopathy, which means there's increased risk of developing a clot. However, it has not shown that there is increased or higher risk of vaccine-induced thrombosis and thrombocytopenia in pregnant population compared to the non-pregnant population. The risk of VITT is therefore extremely slow with the first dose of Oxford AstraZeneca vaccination, and even lower with the second dose. And the UK government has advised that individuals who are younger than 40 years of age should be offered an alternative to the Oxford AstraZeneca vaccination. So you can see that there is that risk. However, it's very rare and very small. Fetal effects. So a lot of patients I see and people I've spoken to are worried about the effect of this on the unborn baby, and the most common adverse outcome that has been reported is preterm birth, small for gestation age, and major congenital anomalies. It's important to note the percentage of these. So the preterm birth is 9.4%, small for gestation is 3.2%, and major congenital anomalies is only 2.2%. It's important to know that none of the mothers whose babies were born with congenital anomalies had received the COVID-19 vaccination in the first trimester or the periconception period. Now, very important to note is so studies have also demonstrated presence of the SARS-CoV-2 antibody in the neonatal cord blood and in breast milk in response to COVID-19 infection in the pregnancy. Similar effect was also seen after the vaccination. So when do we recommend giving the vaccination in pregnancy and breastfeeding? So important to note, so COVID-19 vaccinations can be given at any time in the pregnancy. If a patient is at higher risk, they should be offered as soon as possible. In low risk situations, the patient may choose to delay it until after 12 weeks of pregnancy. That's entirely up to them, but it should really be given as soon as they hit the 12-week mark. Breastfeeding, women can receive COVID-19 vaccination, and it does not. They don't need to stop breastfeeding if they have the vaccine. Women who are planning fertility or pregnancy or are undergoing any fertility treatment, for example, can also receive the COVID-19 vaccination, and they do not need to delay the conception. How are women counselled? So women are counselled using this information sheet from the RCOG website. They should be supported in the pregnancy with their decision making. They should be allowed to have discussions with their healthcare professionals where they discuss the benefits and risks of vaccinations and the risk of declining the vaccination, which can be quite important. So I think this was very useful. I have certainly learned a lot from this article, and if you did want to refer to it, please refer to it on the RCOG website. But this is what the latest guidance is out there on COVID-19 vaccination and pregnancy. Thank you for listening.